Maharashtra has been the epicenter for COVID outbreak. And within Maharashtra, if you see that densely populated habitations, mostly the slum quarters and the low-income settlements in Mumbai, Pune, Thane, Nasik, Aurangabad are mostly affected due to COVID. And one of the major reason is that population density. The density of the population in these areas in some places is more than 25,000 person per square mile. And you can understand that physical distancing is just a luxury for them. But at the same time, there are certain kind of community points which are most vulnerable for COVID outbreak. And one such community point is community toilets. In Mumbai, a majority of the slum populations, at least we can say more than 70% of the slum populations are dependent on community toilets. And on an average, one toilet seat is being used by more than 150 to 200 people. So you can easily understand that the chances of infection is so high in such kind of practices. So UNICEF Mumbai, along with development partners, corporates and local CBOs and NGOs, has started working in these community toilets, these touch points, since early April. The idea was to assess these touch points, reduce the load of usage of toilet in community toilet seats, and at the same time bring certain protocol in terms of operation and maintenance. What has happened after COVID, all the community toilets, pay-and-use toilets, have made free of cost, and which has also increased the footfall in the community toilets. So physical distancing and infection prevention and control in these community toilets becomes very crucial. So some of the interventions are like designing very innovative pedal operated hand washing stations in the community toilet, so that any person using toilet, before using and after using, the person have to wash their hand. At the same time, cleaning intensity has also been increased. Previously, if it was for 2 or 3 times in a day, now it has increased to at least 5 to 6 times in a day. At the same time, we have also introduced a concept called deep cleaning. So with the cleaning intensity being increased, so there is also increase in the demand of consumables. And consumables need to be supplied in a larger number to sustain these practices till post-monsoon. Because the monsoon period is also very critical and we have to contain this virus. So along with the consumables, there is also special effort has been made to give protection gears to all these community and sanitation workers, because they are at the forefront of the battle. And for me, I always say that sanitation and improved hygiene practices is the best possible vaccine available to us to prevent this containment, along with respiratory hygiene. So I am hopeful with the project named Flush the Virus, along with corporates, development partners, NGOs, CBOs, we can reach out to maximum number of community toilets from Mumbai, Pune, Thane in coming days, so that infection prevention and control at community places can be maintained and we can demonstrate a scalable model. Thank you.
I am Matthew Mattam, one of the founding members of Center for Youth Development and Activities, CYDA Pune. CYDA is almost a 21-year-old organization working in the various communities on the issues of education, health and livelihood. Working during emergency is one of our core focus and core work areas. First week of June, there was a surge of positive people in Yerwada. Yerwada is one of the biggest slum settlement in Pune city. We found that more than 700 positive people and almost 30 people have died by that time. We as an organization felt that we need to do something to contain the spread of virus. It was that time that we initiated a project with the support of UNICEF, Flush the Virus campaign. We selected almost 36 volunteers from different parts of the slum settlement, organized them, trained them, and we also got support from organizations like Persistent Foundation and Tree Foundation. When we talk about community toilet, one of the major focus should be work with the caretakers of the community toilet. We organize the meeting of the caretakers. Caretakers explain their difficulties and their requirements. We supplied vinyl, hand wash stations, as well as also to ensure that caretakers pay more attention. We also distributed ration kit and hygiene kit to the community caretakers. We already provided almost 50 hand wash stations to all the community toilets. And we distributed almost 3,500 ration kits to the community's needy people, and that came up at a critical time when the people were not able to go out of the house and most of the shops were closed, and that really helped them to be inside the house and to reduce the spread of the virus. As we are end of July, we found a tremendous reduction in the infections. We are hopeful that sooner we will be able to flush the virus from the entire slum population.